I would like to elaborate more on stuffy nose due to allergies, which leads to chronic mouth breathing. The major culprit is untreated allergic rhinitis since young, which causes the stuffy nose. It is regarded as a normal flu and commonly not treated aggressively. Allergic rhinitis disease causes children and adults to get into the habit of mouth breathing. The tongue is postured low when the person is mouth breathing, and the pressure on the palatal bone for normal jaw expansion and widening is now absent. This then contributes to a host of problems such as sleep-disordered breathing and impediment to the growth and development of the jaws, also known as the craniofacial system. So if you have a child sleeping with their mouth open and breathing through their mouths, it is an indication of some part of the airway being obstructed, and if left untreated, it will affect not only the jaw development, but also a host of other compromised health issues, to name a few. If a child is a chronic mouth breather, there is a higher chance to develop enlarged tonsils and adenoids. These glands suddenly play the main role of the nose in filtering and disinfecting the air through the mouth. But because this isn't its primary role, it eventually becomes swollen. The swelling leads to further obstruction to the airway. There's also a high chance the child or the adult has allergic rhinitis or the normal flu, so to speak. The child has difficulty in focusing and concentrating. There will be some compromised cognitive abilities. The child or the adult mostly have poor posture, namely a forward head posture. There's also a high chance the child will develop sleep-disordered breathing. It's also a high chance for nasal abnormalities such as deviated nasal septum and hypertrophy of the nasal turbinates. And this leads to the unfavorable growth of the craniofacial system and crooked teeth. These are called vertical growers. Typically, the face grows longer instead of more forward. A mouth breather presents with a narrow face, poor definition of cheekbones, receding chin, crooked nose, crooked teeth, tired eyes, a smaller airway, and a bad posture. Whereas a nasal breather presents with a well-developed jaw, good definition of cheekbones, alert eyes, straight nose, straight teeth, being able to house all teeth, a good airway size, and a good posture. A face that is growing healthily, which is horizontally forward, is able to sustain a patent breathing passage, and a patent airway leads to better sleep. In my practice, the experience of treating patients with sleep disorders has greatly increased the importance of non-extraction treatment to create good tongue space, which can best be accomplished when the child is young and growing. This could be the best time we can truly expand the airway and help the patients sleep better the rest of their lives.